Quantum Physics for Doctors, Mystery Object in Medicine by Ramana Annamaraju. Dr. Champagne is a critical care physician and faculty member at Stony Brook University School of Medicine and a member of Pulmonary Critical Care Division. Dr. Pania is the prime investigator for a large study across multiple medical centers around the world about bringing people from cardiac arrest. Cardiac arrest is the arrest of pumping blood due to the malfunction of electrical activity in the heart. Cardiac arrest results in death within minutes without quick resuscitation. The resuscitation is the combination of procedural techniques of bringing someone from edges of death. One of those resuscitation techniques is a cardiopulmonary resuscitation, popularly known as CPR. Any delay administering in CPR, even for minutes, results in certain death. But there are certain exceptions and anomalies that raises several questions than answers in medicine and science.
34-year-old Audrey Mash went hiking with her husband on November 3rd when things took a turn for the worse. The couple got lost and Audrey went into cardiac arrest from severe hypothermia. But 6 hours after her heart stopped beating, doctors at Barcelona's Vall d'Hebron hospital were able to resuscitate her.
Amazing. It's like a miracle.
Audrey Schumann fully recovered and went back to her life as Audrey Schumann. Listen carefully what I said. She came back to life after dead for 6 hours as Audrey Schumann, not as a Margaret Thatcher, not as an African princess. Which one or what entity told her she is still Audrey Schumann? This is not some religious or a philosophical question. This is still under purview of scientific inquiry, particularly the process of cardiac arrest. Dr. Champagne is a prime investigator for the study called AWAKE, examines the process of dying and reviving. He conducted these studies in multiple medical centers around the world with reputable physicians with more than 2,000 subjects who went through cardiac arrest and successfully revived. Dr. Champagne argues there is a presence of some entity that is external to our world beyond our space and time, reminding Audrey Schumann her identity. That entity is called consciousness. The study is a scientific odyssey of consciousness, the journey through an unknown world about some kind of a subjective awareness. Dr. Champagne had faced resistance from scientific establishment without giving a due process and trying to sweep the studies under the carpet. The detractors' claim is the so-called consciousness has no place in the field of medicine. But Pania may have support from an entirely surprising field that is not so related to medicine, that is quantum cosmology. Andrei Linde, a well-known Russian-American professor of physics at Stanford University, gives a mathematical proof for the existence of consciousness. Linde was one of the authors of the theory of inflation. Professor Linde is a member of the National Academy of Sciences. When you apply quantum laws to the entire universe, the total energy of the universe must be equal to zero. If that is the case, nothing happened, nothing should happen, and nothing will happen in the entire history of universe. If everything is a zero-sum game, the act of you watching this video never happened. But the facts dispute, you know you're watching it. That is a scientific paradox. To solve this paradox, quantum cosmologists reluctantly injected an entity called conscious observer. Your physical body is not excluded from the universe, but your consciousness is. Your mind became an observer. Now the entire energy of the universe can be equal to zero, your consciousness being the recorder of the history of the universe. Consciousness is the only way out to satisfy the mathematical equations of the universe. British professor of cognitive and computational neuroscience at the University of Sussex, England, argues there is only one thing there is. It is consciousness, and there is no evidence for anything else. But as a physician, you are wondering what is a patient's care is anything to do with the consciousness. But physician and the brain of a patient have one common purpose: keeping patient alive. You don't have to be smart to feel pain, just you need to be alive. Inside the brain, there are no lights, no sounds, no smells, and only electrical signals. We recognize and experience these signals through interpretations as a reality. It is certainly second person's perspective, mistaken for direct experiences.
A fake rubber hand is placed in front of them. Then both hands are simultaneously stroked with a paintbrush while the person stares at the fake hand. Now, for most people, after a while, this leads to the very uncanny sensation that the fake hand is in fact part of their body. And the idea is that the congruence between seeing touch and feeling touch on an object that looks like a hand and is roughly where a hand should be is enough evidence for the brain to make its best guess that the fake hand is in fact part of the body.
The famous rubber hand illusion and the extension of that one is with the magician David Blaine performing touch experiment with the actor Will Smith and his wife Jada Pinkett. In both experiments, brain is wrongly guessing someone is poking them without being touched. Brain is clearly confused what is and what is not parts of its body. But brain has a bigger responsibility, keeping you alive. Sensory signals coming from inside the body are continuously telling the brain about its state of its internal organs, how the heart is doing, what the blood pressure is like, and so on. Patient perception is not just hysteria, it is a valid signal from the brain. Brain is a resident real-time monitoring system for keeping physiological variables within the bounds for its own survival. Anil Seth and his colleagues believe consciousness acts like a software platform for the biological interactions. Patient is not only a conscious observer of his or her own body, but also a particular participant. You can witness manifestation of consciousness in the doctor's waiting room, particularly if they are Medicare patients. In 1996, a group of people between the ages of 19 and 24 and a group of older people between the ages of 60 and 80 were asked to count out 3 minutes in their heads without watching the clock. The group between the ages of 19 and 24 clocked an almost perfect 3 minutes and 3 seconds of real time, but the older group did not stop until the staggering 3 minutes and 40 seconds. In a paper published recently by Duke University professor Adrian Bejan presents an argument based on the physics of a neural signal processing. He hypothesizes as we grow older, brain processing power is inversely proportional to the time in their mind. So older patients feel time is moving faster than real clock because their time scale is different in their conscious mind. As a physician, if you think there is only objective-based medicine, that's all there is. It is certainly a wrong conclusion. Next time, if you are walking by a patient on a life support system, show respect as they are conscious, reminding yourself Dr. Champagne's studies. Next time, before you dismiss a patient is hysterical, think of Dr. Anil Seth's studies that the patient's brain is the best patient monitoring system there is. If a Medicare patient complains he or she spends more time in waiting room than others, you realize Dr. Adrian Bejan studies patient's conscious time is different than clock on the wall. If you try to understand the conscious observer behind every patient, you see a great wonder and a mystery. You will become a perfect healer of body and mind. Computers cannot replace physician as such because the still unknown, still mysterious entity called consciousness is not computable. Only other conscious observer like you has the power to understand. This is Ramana Hannamaraju. Thank you for watching.